Hi, I'm Julie Tanguay-Gordon.
I'm Sonia Marcel.
And I'm Joanne McNeil. We're registered dietitians at the Ottawa Hospital Cancer Centre.
We have developed videos in French and English on the nutritional guidelines to help manage some of the common side effects of cancer and cancer treatment.
Remember, everyone is different. Follow the suggestions that feel right for you.
Is your mouth dry? Are you feeling tired? Is your urine or pee dark yellow? Are you often constipated? If you do the pinch test on your skin, does your skin not bounce back quickly? If you answered yes to any of those questions, you may be dehydrated. In this video, we're going to discuss the importance of hydration, the signs and symptoms of dehydration, as well as some tips to keep you hydrated. So why is hydration so important? Water is the most essential of all nutrients and probably the one most often taken for granted. Our bodies are made up of about 2/3 water, and many of our body processes depend on it to work properly. Water is needed to maintain the temperature of your body, remove waste and toxins from your body, control your heart rate and blood pressure, create saliva, and deliver nutrients to the cells in your body. Without enough water, the body can't function as it should, and losing just 10% of the water in your body can cause health problems. Dehydration happens when a person does not take in enough fluid or loses too much fluid. Every day, we lose water by breathing, sweating, going to the bathroom. Most of us are able to replace this loss by eating and drinking. However, there's some conditions that make it difficult to stay properly hydrated, such as diarrhea and vomiting, which can be side effects for cancer patients going through treatments. So be aware of these signs and symptoms of dehydration. Getting dizzy when you sit or stand, headaches, confusion, decrease in urination or dark yellow urine, dry mouth, constipation, fatigue or being tired, irritability, and fever. The consequences of dehydration can be quite severe and include difficulty doing tasks you're normally able to do, being more susceptible to falls, being susceptible to infections, and fluid and electrolyte changes. If you're undergoing cancer treatments, drinking enough fluids is even more important and can have a big impact on your treatment plan, how well you tolerate treatments, as well as the recovery after treatment. For example, being well hydrated helps flush the chemotherapy drugs from the body. If you're not drinking enough, these can stay in the body longer, increasing your recovery period after a chemotherapy treatment. Since symptoms of dehydration do not appear until you've lost a lot of fluid, the best approach is to prevent it. Here are several tips to help stay hydrated. Aim for 6 to 8 cups of fluids a day for women and 8 to 10 cups of fluids a day for men. Carry a water bottle with you. Drink fluids throughout the day. You may need to drink even when you're not feeling thirsty. Limit caffeine or alcohol-containing beverages, because these can increase dehydration. Drink most of your fluids between meals so you will not be replacing the food with fluid. And if you have diarrhea, have 1 extra cup of fluids for every loose bowel movement. Fluids include a variety of non-caffeinated, non-alcoholic choices, including water, milk, herbal teas, soup or broth, juice, whether it's fruit or vegetable, a nutritional supplement such as Ensure, carbonated beverages, for example, carbonated water or ginger ale, Jell-O or popsicles, and yogurt drinks. Actually, anything that's liquid at room temperature counts as a fluid, even ice cream. If you're having difficulty maintaining your weight and getting in enough fluids, try some of these high-calorie fluid options, including a meal replacement drink like Ensure Plus, whole milk or chocolate milk, soy beverages, milkshakes and smoothies, fruit and vegetable nectars and juices, and you can dilute these if necessary. Sherbet, ice cream, and frozen yogurt bars are good options as well. It's very important to call your healthcare team if your diarrhea continues for more than several days, if you feel weak or dizzy, or if you develop a fever or severe abdominal pains. Staying well hydrated will make a big difference in your cancer care. We hope you found the information useful. Please visit our website for more tips and handouts on dealing with side effects and symptoms.